Welcome to part 2 of my deadlift series. So in this video, I'm going to talk specifically about how to set up for the barbell deadlift. We are going to go over the conventional deadlift, the RDL, and also the sumo deadlift. I'm going to talk a little bit about different setup cues that might help you feel it more in, say, your glutes and hamstrings and, say, the lower back. But my caveat here as I talk about troubleshooting, and I know I covered this in the dumbbells video, but again, depending on which one you watch, I don't want you to miss this piece of information, is one of the misnomers of lifting, especially when we start lifting heavy, is the idea that to do something correctly, we have to feel it in a specific muscle group. The reality is that especially when you're lifting heavy and you start getting into those heavier rep schemes, it's very possible that as you're doing an exercise, you don't feel any of the target muscle groups. You just feel the effort of, for example, getting the bar off the ground and getting it back down. It is also possible to do an exercise correctly or do an exercise well and feel not just your glutes, maybe feel a little bit more of your lower back, a little bit more of your hamstrings and other muscle groups in general, because the truth is that sensation does not equate with muscle engagement or progress over time. Same thing with soreness. If you are well adapted for an exercise, it is entirely possible that you are not going to be super sore after every single workout. And that doesn't mean that anything is wrong. It actually means that your training is appropriate for you. You are hopefully doing enough to challenge yourself. And if you're seeing improvements, then that is true. But ideally, you're not doing so much that you can't recover from it and you're sore and creaky all the time. That's not really what we want either. So the sweet spot is actually to be able to do something well and not be super sore all of the time. Final thing I want to say here is there is a difference between soreness and like ongoing ouchy, sharp pain. So if you are noticing that things are very painful and uncomfortable, then yes, you should certainly work with a coach or a physical therapist or someone who has a background in strength to kind of evaluate what's going on with you and help you figure out what might be going on. But just know that muscle sensation alone isn't going to necessarily be the best guideline for where and how you feel things. Now, that said, muscles do respond to both position and load. And so sometimes when we're in certain positions, it might be that we do feel, for example, our lower back a little bit more. And in other positions, we're going to be more optimally loading our glutes. And so when I talk about technique, that is some of what I'm going to talk about here. So let's get into the basic setup of the conventional deadlift. So you are going to have your feet about hip width apart, take or give. And then you are going to be standing with it where you are going to have the bar lined up kind of just over, let's say, the midfoot. From there, and I will show this from the side as well, you are going to come on down. You are going to take your hands, if you see here, about shoulder width apart. So if I have my thumbs here, this is about where I'm going to usually end up grabbing the bar. And again, you might have different body proportions than me. You might have shorter legs or shorter arms or a longer torso. So your setup might be a little bit different, but a good guideline is kind of like where your thumbs are. If you come down, that is going to help you figure out where you want to be. So once you are there, you are going to wrap your fingers and thumbs around the bar. You're going to think about breaking the bar by pulling your shoulders back and notice that my elbows are straight. And then this part is the one that people miss a lot. You're going to actually shift your weight slightly back. So you're going to take the slack out of the bar and then you're going to stand up. And then you're going to think about almost scraping the front of your legs. Knees are soft to come down. Again, I'm going to pull my shoulders back, take the slack out of the bar, come up, and then come down. So that is the basic setup. Again, I'll show it from the side. Let's talk, though, a little bit about some of the things that get a little bit funky that might cause you to, for example, feel your low back a little bit more. So the first one is that idea of not taking the slack out of the bar. So in case you missed that, there is this moment that I am shifting a little bit back and then I'm coming down. If I don't take that moment to really set my lats and kind of find my feet. Now notice I'm not in my heels. My whole foot is staying on the ground. So when I sit back, I'm really pulling the bar back. I'm not leaning super far back. I don't do that. If let's say I just don't set my lats, I'm going to do that here. The bar is going to drift forward and I'm going to absolutely have to use my lower back more to pick it up. Let me show you that from the side. All right. So this first one, I'm going to purposely do it well. I'm going to take the slack out of the bar, and then I'm going to show you what happens if I don't do that and I let the bar drift forward. So shoulders pull back, slack is out of the bar, standing up, and then coming down. Also, people ask where to put your gaze. There's a lot of debate on this. I think slightly forward works pretty well for most of us. You don't want to be really craning your neck, but again, where you feel comfortable in your neck is probably a decent spot. All right, so let's look at what it looks like if I don't purposely set my lats. So if I don't do that, if I just kind of grab it and I stand up, notice already how the bar, there's more space between the bar and my shins. And when I do that, my low back is absolutely going to have to work more versus if that bar is pulled back. The other thing that happens sometimes is people don't bend their knees enough to get under the bar. So there's a little bit of a funky timing thing happening with it. So if I don't bend my knees enough, if I start here, notice how my butt is really high in the air when I do this. Even if I set my shoulders back like I'm supposed to, the timing is off. My lower back is going to have to help me pick up that bar. Versus if I bend my knees quite a bit, I set my shoulders back, and then I just stand up all in one piece. My hips are now the driver. So that's something else to keep in mind. The third piece of this, and this is bringing me to the RDL, is if you don't have good hamstring length or hip mobility, you might find that you can't get wedged into that position well enough to really activate through the glutes and the posterior chain. And then again, you might feel it in some funky spots. So if you know that it's really hard to get there and kind of set your hips, set your back, put yourself in a position that's advantageous, you might benefit from doing a RDL instead of a conventional deadlift. Now, you're not going to have that moment to reset at the bottom each time. So what I would probably suggest is going a little bit lighter in weight. And you might want to then also work on things like hip mobility, hamstring length, all of those things outside of your strength practice, and knowing that those things will come in time. And you'll probably find that over time, it does get easier to be in the conventional deadlift position. So for an RDL, your setup is really going to be the same, where you're going to have it shins into the bar. You're going to think about pulling your shoulders back, setting your lats. And then I kind of use the top to really reset. Now notice I'm not like pushing my hips forward, thrusting my ribs. I really am thinking about keeping my ribs connected over my pelvis, and it's really a lat exercise with straight elbows. And then knees are going to be soft. I am going to slide the weight down my shins and standing up. So what this does is it is going to allow me to bypass this place where I need more mobility in kind of that bottom half. Another note here on the RDL, if you keep your knees really, really straight, you are going to end up using your hamstring and lower back more. That is not a bad thing. It's just that becomes then a stiff-legged deadlift, and you're actually biasing more hamstring and a little bit of low back work versus glutes. So let me show you the difference between a stiff leg deadlift, which is going to look very much like an RDL, but the knees are straighter, and an RDL. So again, RDL, usually a little bit more glutes, stiff leg, more straight leg deadlift, usually a little bit more hamstring and low back. Neither is wrong, neither is bad, but they are different. So if you're trying to isolate one muscle group more than another, it's a good thing to keep in mind. So setup is the same. I like to find my position at the top. First, I'm going to do the RDL. So notice knees are a little soft. The knees do have some bend in them. Not a ton, but enough to just allow me to really get the weight in my feet and my glutes, versus if I purposely keep my knees quite straight. Just notice, I already feel that more in my hamstrings. My range isn't as big. And I have to use my hamstrings a little bit more and my low back a little bit more versus knees soft. Allowing a little bit more knee bend is going to be more, again, glutes. So the final thing I want to note here is for some of us, this narrow leg position just doesn't feel great. Depending on your body proportions, your exercise history, your injury history, your pain history, your mobility, It might be that you just don't do super great with a narrow stance. And so there is nothing wrong with taking a sumo stance instead. So for the sumo stance, I'll show it from the side because we're already here. Then I'll show it from the front. Legs are going to be a little bit wider in this case. They're going to be turned out. Now, quick note here. When I do this, I don't want to wrench my feet out to the point that my knees are inside of my feet. My turnout needs to be, your turnout needs to be wherever you can really track knee over second toe, take or give. So just be mindful that you don't turn out away from the foot. You really want it to come from the hip, and then the foot just naturally follows where the knees and the pelvis are lined up. So I'm going to find my wider stance. Now my hands are going to be inside of my thighs. The rest of this is pretty similar. So knees have quite a bit of bend. Notice I am not butt in the air. I am thinking butt is slightly down. Knees are quite bent. Wrap my shoulders, find my lats. And then again, I'm going to think about pulling it back. There's a little bit of weight in my heels, but my toes are on the ground to take the slack out of the bar. Stand up. And then coming down. So I'll show it to you from the front as well. All right. So here, ignore this one on the way down. It's not going to be the prettiest transition. All right. So now let's look at it from the front. So again, I have very long legs. My stance is probably quite wide. If you have shorter legs, longer torso, your stance might be a little bit different. That is okay. But the point being, a little wider than hips, a little bit of turnout. Come on down. Wrap the shoulders, slack out of the bar. Stand up. Keep the bar close to the thighs. Coming down. Again, standing up. And coming down. So hopefully that gives you some things to play with using the barbell. I really hope you found this video helpful. If you have any questions, please let me know. And I'll see you in part 3 of this video series.